A plethora of patients. First to 10 area hospitals are packed and running out of space, but they have a plan. The hospital overload comes as more people are returning to town for school and big events. Good evening and thanks for being here. I'm Chris Carter. Both Jonesboro hospitals have said the number of patients coming through the doors is up. It comes as more people nationwide are being hospitalized for COVID-19. The Health and Human Services reported there are currently just over 11,000 people hospitalized nationwide. That is up more than 23% in the last 2 weeks. More than 1,600 are in the ICU, an increase of 27% from 2 weeks ago. Our Alejandro Hernandez is live at NEA Baptist tonight with what both hospitals are saying. And Alejandro, this is a big deal.
Hey, good evening, Chris. Yes, the emergency rooms here in Jonesboro are seeing an uptick in patients now. That is expected for this time of the year, but both hospitals are also trying to make sure that they have enough room for these patients.
Jonesboro hospitals are busy. Emergency rooms have seen an influx of patients.
The emergency room volume lately has been pretty heavy.
Dr. Steve Woodruff with NEA Baptist said the volume of visits has risen since the epidemic was declared over in May. He said there has been a 10% increase from last year, with the ER seeing 150 to 200 patients a day. The hospital has been able to reduce the amount of time patients stay in the ER.
And because we've done that, we've actually created about 10 to 15% more beds in the med-surg department.
NEA is not alone. Mitchell Nail with St. Bernard's said its ER has seen an uptick in patients too.
As more people are gathering together, you're seeing more illnesses, and of course, we just generally have more people packed in and around Jonesboro.
St. Bernard's keeps a daily bed plan for its patients.
It goes up and down based on what the needs are, and so while there may not be a bed that's immediately available, if you are at our facility, we are doing everything we can to make sure that you have a room that's ready.
The ER can go into a diversion when it's full, but Dr. Woodruff at NEA said patients will still get care.
We're not going to take transfers from another hospital, but people still come here. And if somebody says, I want to come there because my doctor's there, they'll still come.
Now, a recommendation I got from both hospitals is to try and visit your primary care physician if you can, or if your symptoms aren't too severe like a cough or a sore throat, to maybe try to visit those urgent cares, and maybe that way you can stay out of the ER. Live in Jonesboro, Alejandro Hernandez, K8 News.
Good information. Thank you, Alejandra. Area hospitals across the country are saying a rise in hospitalizations as COVID cases continue to rise.